and they put all of their information into the background screening information. That makes me cringe, like super cringy.
So self-reporting compared to...
Right. So they put it in. For instance, we had one yesterday that someone put it in and she uses her middle name as her first name. So that's how they put her name in. But that's not her legal name. She has a different first name. So then when some of the initial searches are done, they are automated now. And so they go out. Well, everything that was done, completely useless because it was searching the wrong name. So that's always been a thing. Good information in gets you good information out. If you have the wrong information in there, having done this back in the days when we had to look through books that were this thick to find training programs, or even what city a county was in, and the encyclopedias were this thick, being able to now do a lot of that electronically is fantastic. But I still have little control issues because I know the information is right. I've fact checked it a lot of times, but having that control that we always did everything manually and knowing that a person was doing that search, that's been a hard thing to give up in the electronic world, and trusting that the information that you're getting back, it is right.
Trust but verify. Sure. Have you seen an increased demand related to the remote or the hybrid work environment or any other pieces? Like even, COVID, you said things slowed down. Has it picked back up and corrected?
So much. I don't think that the processes themselves or there's been any real difference in the information that people want in the backgrounds. I don't think that's changed as much. Again, just like I said, though, usually if you were applying for a job in Texas, you either lived in Texas or you just moved to Texas. I think that's the biggest difference in that. It's just knowing that where an individual actually is versus where the company is. That's been a big thing. It is definitely in the healthcare industry, and I'm sure across the board, has picked up. It probably took into mid 22 before things really started to move again. Now it's crazy busy. The other thing that I've seen really within the healthcare industry is previously, and I'm not really sure, and maybe you have insight on this too, Christy, recruiting used to be kind of autonomous, right? They did the recruiting, they did all their sourcing, they did all of that. They did the backgrounds if they wanted to do the backgrounds on the front end. And then it moved on from there once they signed their contract or whatever. A lot of that now has gone under HR. And that's odd to me. So I'm curious, do you have insight into that? Because I know you've seen that happen as well.
Yeah, I feel like my teams would typically do some light touch verification in advance of bringing someone for a site visit. So, a FAFSA level 3, some publicly available data. They were at least saying, yeah, they have a license and they haven't killed somebody, right? There wasn't any action on their license, things like that. So we did some investigation before we brought them in, the expense of bringing somebody for a site visit. There was always that other background check that HR did, the employee one. And to your point, it's probably not as detailed as it needs to be for all the things the physicians, the baggage they could have brought with them. And then I think a lot of organizations are still relying on the medical staff office to really kind of be that gatekeeper of, if they're not going to pass credentials or, things. It was rare for people to not pass background because at some point we were looking first. Often what they wouldn't do is pass credentials, right? That's where they usually missed. If it was background, it usually was they failed a drug screen or something. It wasn't even really background. So all of that gets lumped in during the onboarding process. I think a lot of our experience, it did technically live with HR from a background check perspective, but then the credentialing, that CDO type, it was often they were just two separate things. Unfortunately for the candidates, they're providing the same information typically over and over And then again for payer enrollment, and so that's where there was just a lot of rub with, I just sent that to that person. Can you not share it, a license or a copy of a diploma or whatever? That's where we got just bad feedback from that part.
It's interesting that you say that, because one of the things that we've started doing is helping the providers with their med staff applications, which from my standpoint, I was like, well, this should be easy because we help facilities. We work with some med staff offices, so we're actually getting all those primary source verifications for them. So I'm thinking this has got to be a breeze because we already know where to go to get all the information. We can help the providers with their applications. We know what they need. It's been a bit of a nightmare, actually. And part of it is because of that. You would think that the providers would have a folder that has all of their documentation in it. So they can very easily shoot that information over to you. Why would you not have that all in there? But then to what you just said, then you have payer credentialing and the medical staff office. And I will say, we uploaded that into the application. That was one of the very first things that you asked for. And then payer credentialing will ask for it. Do y'all not share that information with one another? Because that's super, super frustrating. I did want to go back to something that you had said, like you guys would do a little bit of investigating on the front end.
Yeah. Tell me your thoughts on Googling providers.
Exactly what I was just going to talk about, because that wasn't something we could do 30 or 40 years ago, or even really 20 years ago, that would be as comprehensive as it is now. So my thoughts on that are, be very, very careful. There are companies out there that say that they will do social media searches for you. And even for us, they'll say, you should offer this to their clients. I'm saying I will not touch that with a 10-foot pole. Here's why. You could do the search, but you can't use anything that you find out in that search in your hiring decision. Also, once you know something, you can't unknow it, because we are human. And as much as you'd like to say, I know I can't use that in my hiring decision, you know that you're going to. The EEOC nightmares that brings up is not worth it. So there's religion and sexuality and even, are you married? Do you have children? You can't know any of that. But here's the other side of that, Christy. If for some reason you hired someone and there was something out in the public on social media that would have given you a heads up to that particular situation, and you hired them anyway, then they could say, well, you should have known this and you hired them anyway. So then you're stuck in negligent hiring. I think what we said before, be skeptical. You can look, always verify. Don't just take that as face value, and make sure that you can document that somewhere else besides a Google blog somewhere. So yeah, Google, it's a great tool, but you just have to be so careful what you do with that information.
The organizations that I've worked for, definitely our HR leaders and our legal teams were very conservative. It was a no Google, because you're right. Once you open it, once you read it, once you see it, it is impossible to not think about. And the cases that my legal teams always gave us was really, if charges were filed against somebody, okay, they're not convicted of that. And so, again, you read it and you're like, oh my gosh, if you made a reaction on that, which includes a hiring decision, and then first, was it even the right person? So many common names out there. There's just so many misconceptions of what you read on the internet. So my teams, we didn't do that. We didn't Google. Definitely that was led from the top down, from a legal perspective, of the risk it would put the organization in.
I'll really stress this, because I know that there are a lot of organizations that they're Googling them, is verify, 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 verify. The names, I hesitate to tell this story, but I'm going to anyway, because it was a Google situation and the provider was caught up in a prostitution sting. So we couldn't find these charges. So because they eventually got dropped. However, there was video, because they were videoing the hotel room and there was clear evidence of the provider going in. It was that person. So the charges got dropped, but charges can get dropped for all kinds of reasons. I'm not sure. I guess luckily for us, there were other issues that came up. Then because of that, we started looking in other counties in the surrounding area and found other things. So again, great investigative tool. But of course, we couldn't report any court records in that county because the charges were dropped. But it did give us a great way to start looking in that particular area. And then we were able to find things that we were like, now we can tell you about that. Because that's another thing. Your background screening company certainly doesn't want to miss something. And then you find it. Because you're like, hey, my provider was caught up in a prostitution sting. How come y'all didn't know that? You don't want to hear that as a background screening firm either. So yeah, I'm glad that you asked about Google though. So just be careful.
I think I need to proceed with caution. And any new recruiters, just getting started or whatever, ask your attorney, ask your general counsel of your organization, because ultimately you will all be put on the stand or called before. And so really, really understand the level of risk and comfort that your organization has with you doing those things. I know CEOs do it all the time. I would get really, really frustrated trying to counsel them on why they need to be cautious. It just didn't ever seep through. So I just said, well, I can only control me and know that this is what I'm not going to do within that, because I definitely didn't want to have to get up on a witness stand or be deposed. And I've had recruiters who've been there on discrimination suits and things like that. I think it will get worse over time. Most of these things usually do with these types of lawsuits. And so just want to be cautious.
And that's huge for us, for our industry as well. And I'm talking both on both the background screening and credentialing. We have to stay up on so many regulations all the time. Like I said, even the time frame, like how far back can you report? What type of things can you report? And I think that those are just, again, like you said, they're just going to keep getting tightened up. We have to be careful. And I think this might be something that people don't understand as well. Just like on your credit report. Let's say you pulled your credit report and you saw there was an error on there, right? You can dispute that. It's the same thing with the backgrounds. They'll have like a pre-adverse action letter sent, like because of what we found in your background, we are going to rescind the offer, or whatever stage you might be in at that point. That person has a right to then see their background and then dispute any of the information in it. I will tell you, again, I've been doing this a long time. I've never had anybody dispute the information and us have to correct it. But there are times, like maybe the court document didn't get filed, and so we reported it as still open when it was actually closed or something like that. Those things can happen. But yeah, you as a consumer, the providers, the support staff, whoever, they have a right to see that background. They have a right to dispute the information in the background. Mostly what I see is they don't really have a grounds to dispute the information. They just want to see what it says. Because I have had those kind of disputes come back before, and they'll say, well, was it okay for you to report that? I'm like, yes. And I'm saying, are you disputing the facts of the information that were there? And they'll say no. And then you're like, so we can't take it out just because you don't like it in there. So that's always a thing. Like, you have to have a reasonable dispute, not just like, I wish you wouldn't have put that in there. That's not really a dispute. But yeah, anybody has that right to do that. There are some states, such as California, where if we do a background on someone in the state of California, they automatically
receive a copy.
Yeah, that's just how they are, because it's California.
I think that'll become more common. There's so much information about people floating around that, kind of like the pay transparency laws, I just think a lot of it is opening now because of the internet or technology, and people are demanding, it's their right, but like make it simple where they just get a copy of it automatically versus trying to hide it or use that as an excuse not to hire somebody.
Did you know PracticeLink, the nation's most trusted physician recruitment resource, now offers PracticeLink Pro Marketing? PracticeLink Pro Marketing is a brand new, powerful recruitment sourcing solution built just for healthcare organizations. With custom strategies, targeted reach, and data-driven results, PracticeLink Pro Marketing helps you attract top-tier candidates and fill hard-to-reach roles faster. Ready to elevate your recruitment game? Visit PracticeLink.com and schedule your free consultation today.
As we talk about tips for new recruiters or employers, what are some red flags that they should be looking for when so let's say I do get a background check on somebody. What should I be looking for, kind of top 3, 4, 5 things?
I think it starts even before you do the background, right? Just when you're looking at a CV, you want to look for time gaps, because if you don't get the explanation of those time gaps in front, that the credentialing office, the med staff office, they want an explanation. It used to be like 90 days. Now they're going down to 30 days. Like, where were you? So looking at the CV, the time gaps, if somebody's not board certified, there's no excuse for that these days. And so that's a big one. Then moving into the background itself, if they don't sign that release for you and they have an issue with that, I tell everybody that's your number one red flag. If they are interested in your opportunity and they won't sign that release for you, I just say walk away. We have had more recently ones who don't want to provide their social security number particularly on it, and they'll cite, identity theft reasons. Well, we have all kinds of ways to make sure that that's secure. So if they don't want to write it down on there, we put it into a secure portal, things like that. So they'll try to get around that in lots of ways. Well, like, I don't want to sign that. I don't want to give you my date of birth and my social security number. Well, you need that to do a background. And going through the rest of the process, at some point, they're going to have to give it to you anyway, because, they're not going to get through credentialing without that. I tell people looking around when they hop around to a bunch of different locations, that's a big red flag. And sometimes it's because people make a great first impression and then they get there and they're not at all the person who presented themselves to you. And that can, be at any level of employment. But I would say those multiple locations, the reluctance to sign the release, reluctance even to apply for licensure, and, that's going to take me a while, things like that. Those are big ones. And then women that don't want to give you all their names. Like, when you ask for their names, please provide all of your names. We're not judging. We don't care. We just want to make sure that if you've only been Jackson for 2 years and you were something before that, if I do a 7-year search on you under that name, it's only really giving me 2 years of information. I need to know. And some foreign medical graduates whose names are long, and also they change them a bit when they come to the US, but all of their legal documentation still has the other name with a first name, a middle name, and then their first name again, and then a last name, things like that. So when somebody tells you what their name is and that's not really what it is, that's annoying.
I would notice where, even within your applicant tracking system, if there was a hyphen or something, like, it just gets tricky sometimes with the different names, and they want to be called Pete, but their name is not that. So making sure, within your applicant tracking system, you've got a field for the name they want to be called compared to what their legal name is. Where in the recruitment process should they be getting that release and running a formal background check?
So there's a couple of different thoughts on that. I believe the majority of the recruiting departments that I've spoken to and that we've worked with will do it typically after the site visit, but before the actual contract offer, or it's kind of in tandem with one another. However, having said that, it's kind of going back now to some where I'm seeing a shift, and I think it's because of the involvement of HR that they're asking them to do it before they even bring them in for the site visit. Like, once they have the site visit scheduled, and they're like, okay, let's get the background going and see if there's going to be any issues, because if there's any issues and we know that there's interest and we're going to bring them in, let's see if there's any problems before we even get them here and spend all that time and money and all of that on the site visit. Now, the majority of people are doing it after site visit, before final contract offer, and even before it gets to the med staff, before that process even gets there. So they're not even starting the credentialing process yet. They're just doing the background, which can also aid in the credentialing process, which is something that I think is really important to get everybody working on the same page and being consistent. If you can get the recruiting department working with the HR department, working with the med staff all together so everybody knows what the process is, being consistent with that process, which is also going back to the legalities of it. If you're going to do a background on this person, you have to do a background on this person. Now, it can be different as long as you're consistent, right? So you could do one type of background on a resident or fellow. You're going to do a little bit more in depth on somebody who's been out practicing for a while, and do a different one on your APPs, and yet again, different ones on your support staff, right? So you might not care about civil records for your support staff, but you do for all your providers. As long as that is a consistent process that you've taken care of, that you've did your SOP for it, this is what we're doing, then you're golden. It doesn't mean that you can't do more. For instance, like on that one that I told you, like we wouldn't have searched those other counties necessarily, but throughout the investigation, we found that there were other places that we probably needed to look. But as long as you have a standard, consistent process on the front end, then I think you're great. And you can't say, we're only going to do a background on somebody who's been out practicing for a long time or like over 10 years, but we're not going to do it on somebody who just got out of school. You can't do that. You're going to have to do the same for everybody. But again, there could be different levels. One of the other great things, though, about doing the backgrounds from a credentialing standpoint and getting some of that primary source verifications on the front end is if everybody works well together, then you already have all that static information on the front end, like your education and your training and, board certification. You already have that. So then they don't have to get it again. It's already done, which speeds up your onboarding, and that helps things a lot. Because, when I hear systems tell me that it takes them 120 days to credential someone, or even 90 days.
Standard 90 to 120 days. That's what it is, Rhonda.
That's crazy to me. It should never take that long. It just shouldn't. I do understand that some of that's because of the providers themselves and not having their information. Even things like their vaccination records. Everybody asks you for that. You're going to have it. Those are my tips. Work well, play well in the sandbox together. Everybody talk to each other so you know what each other is doing. You don't need to reinvent the wheel, but make it consistent. Make sure that you're doing the same thing on each one so that you don't run into any discrimination issues or anything like that. Make sure you don't ask questions, for instance, to a woman like, hey, when did you get married? Because I saw your name changed. You can't say that. And say, it looks like you had a name change. Can you tell us when that happened? That's all. And that's a fine question to ask. I tell people, be careful about those questions that you ask, like, have you ever been arrested? Most places you can't ask that before there's been a formal offer. Can you say, is there anything that you would like to tell us about? Because we're going to be doing the background. Is there anything that you can ask that question all day long?
That's pretty much how the wording was on the interview forms that I've used in my career. Just, is there anything you want to make us aware of? And then we definitely asked about if they've ever opted out of Medicare, which 10, 15 years ago, there were a fairly large portion, especially primary care physicians, that opted out and went into concierge medicine and just did more cash base. I don't know a health system now that could survive without being able to bill and collect from Medicare and Medicaid. So that was a key one that I think it's passed, but I have not heard of this being a common thing anymore, that the physicians were opting out and not moving forward with filing those claims.
So I had told you one of the red flags is no board certification. And we've seen a couple of times where people are like, yes, I'm board certified. They didn't say they were board certified by the American Board of, so they didn't really lie, but they were not actually board certified. And even just recently, it's great that a couple of these things happened just recently, because there was a provider that was going, and he had been board certified, but he'd been practicing at the same place for like 15 years. And apparently he either, I'm going to say, slipped through the cracks in his re-credentialing, or just nobody paid attention because he let his board certification lapse. And now has to jump through hoops to get it all done again, because he's certainly not going to go anywhere else and get a job because he's not board certified. And I've heard these words come out of his mouth, and it was, well, I've been doing this for, 15 years and I have all the case logs to show it. That's fine. That's great. But if that next facility's bylaws say we have to have an American board certified or American osteopathic board certified, whatever it might be, that's their bylaws. You don't just get to go around that because they're in desperate need of someone in that specialty, because that's why you have those processes in place so those things don't slip through. So I think that's a huge thing because there's just no excuse for that these days.
And in my experience, those requirements, while it's in the bylaws, but those requirements were definitely something that came from the insurance payers. So they wanted to know, okay, if I'm paying on this claim, these providers, these physicians have been vetted and that they are who they say they are, and they are board certified in that specialty to treat that condition.
And, one of the things that's always bothered me forever is a lot of times some providers who want to sidestep processes will go to rural health communities. And that's unfortunate because they are in desperate need and they probably don't have, a credentialing department and someone that's dedicated to knowing all of the things that they should be getting. And I always caution the smaller facilities and the rural healthcare facilities to be really diligent. I hate to say that, and I don't mean to make it a blanket statement. It's just, it is what it is. I've seen it happen a lot, and that's unfortunate. And I would also caution people to look at someone who's been, unless that's just been their lifelong passion, was to, serve the rural community, and now they're deciding that they want to move to a big metropolitan area, to be extra diligent in those situations as well. Again, I don't want to make those blanket statements, but just something to be aware of, I think.
Yeah. I know most recruiters are typically cautious, surgeons, anybody that's in the OR and doing this type of work. And to your point, doing things differently, we did, like residents and fellows, folks coming just out of training was not as deep as the backgrounds and the things you would be looking at for those who have been practicing any amount of time. But have there been any trends over the years for certain specialties or things that you want to flag? I mean, I think especially with opioids or other things, like you get into prescriptive issues just as much in family practice as you do with the spine surgeon. So you wouldn't want to not do it because, well, they're in family practice instead of the surgeon or whatever.
Right. You definitely want to be looking at that across all of the modalities for sure. We had an issue like that in our community where one of our general practitioners, because they call him family med, right, got in trouble for that. I mean, he was basically a hometown pharmaceutical rep for everyone. And so he did get in trouble for it. But years down the line, I always tell people, be careful of anesthesiologists, because if there's ever going to be any that have their own issues, it's usually them. And I apologize to anesthesiologists everywhere. When you ask me, I've been doing this a long time. When you see somebody put on their CV that they have a particular interest in addiction medicine, you might want to ask why they have such a particular interest in that. Most of them will tell you straight up that it's because they had their own bout with that themselves, and that's how it got them into them. But yeah, as far as especially with the opioid crisis that is in our country, I wouldn't even pin down one specialty, but also the APPs, the APRNs, the PAs, and the physicians themselves. There's no line there that hasn't been crossed for all the providers. We talked about that before, but that's the other thing. Don't treat your APPs any differently than you're treating your physicians. They need to be vetted just as strongly. They typically don't have residencies and fellowships, and some can't even have their DEAs, things like that. So, I mean, there are different things that you can look at, but they need to be vetted just as strongly as your providers as well.
Yeah, and I definitely think as you watch the news, when you see drug diversions from nurses and things, could have been in the past, but it was something that happened that you definitely want to uncover their complete work history of what they've been doing. Let's talk a little bit about what motivates you as CEO of Reality Check and really, what drives you for that success, innovation. I know some of the credentialing pieces and some new kind of offerings that you've brought forward for clients, but what really motivates you and drives you every day when you get out of bed?
Really, I thought about this because I knew you were going to ask me this question, Christy. I think it's because I love it. It's super interesting. The stories that I've uncovered over the years can keep people entertained for hours when we start talking about it. I also just have, me personally, I love this industry. Like you said, I've known you for a very long time. The mentors that I had when we first started, I've watched them go from recruiters or recruitment coordinators to CEOs. And so that's been really awesome. The relationships, I can't imagine, and I'm sure that they're out there, but I can't imagine a greater group of people that I call my colleagues and friends than the recruiting industry. It's been great to watch even my colleagues that are other vendors, that are other people that have been in this industry. For instance, like PracticeLink, and watching that grow. I love when I hire new people to work here who don't really know what it's about. And they're like, oh my gosh. I'm like, sometimes it's boring, but sometimes it's super fun. And we learn lots of things. And I've asked my employees before, why do you think you like doing this? And they'll say, because also we feel like we're contributing to making sure that our loved ones and everyone else is taken care of, that they're getting good providers, and we're stopping ones that shouldn't be out there and not letting them get away with things. So I guess that's it. I love the industry and I love what I do.
Yep, same. And I think that it's nice to hear your folks realizing that they are an important piece in saving lives and providing those care in the communities. Equally, that they don't want to put bad people out there that could harm others. That's great to hear, because you guys do play the background check folks, whoever that is that the organizations work with, they do play a key component in making sure you get quality people to serve.
I always caution everyone, there's a ton of background screening companies out there. There's great big huge background screening companies out there. And this is also a trend that I've seen happening more. They want to use the same company to do the support staff as they do the providers, that they question them and make sure that if they're vetting a new background screening company or something like that, that they're fully aware that they should be searching the criminal and civil records on them, that they've had some background themselves of knowing what they need to be looking for specifically in the healthcare industry, because that's important. Your background screening firm should be your first gatekeeper and be able to say to you, I've always said this to the recruiters, like, I don't care if you need an American-born, American-trained female OBGYN. We don't care. What we care about is, are we going to be able to clear this candidate for you and let you know that there's not any issues, that you're good to move forward? Because sometimes people in desperation, want to be like, we just need them really bad. We're just checking boxes. We don't just check boxes. And nobody's background screening firm should be that way. It's not always about how fast you can get it done. It's about how good is that information that you're getting back. So I guess that's big for me too, right? You want to be your gatekeepers.
Yeah, I appreciate the information you shared. And I think that our audience will enjoy learning, as you're first coming in, or even just the general reminders, we get into your day to day, stop to think these things really do matter. And you can't get mad that Cred Prep takes 90 to 100. You can't get mad about it. Work with those teams, try to collaborate, maybe use some technology or some type of similar software where the information sharing is easier from the candidate side, because it is a huge dissatisfier to them to keep reproducing the same documents to folks. But equally, the background check and the credentialing process, it all really, really matters to protect your patients. And beyond that, the reputation of the organization that you work for.
Absolutely.
Well, thanks for joining me today, Rhonda. I really, really appreciate it. It's been good to catch up with you. On behalf of PracticeLink and myself, I want to thank Rhonda for appearing on Workforce Wisdom. For more valuable insights and information on our strategic partners, including Reality Check, visit the Resource Center on our website at practicelink.com or email plmedia@practicelink.com. My name is Christy Bray. Thank you for listening.